Good morning. Welcome to Salina Regional's Morning Medical. I'm Mike Maddock. Today's program, we're going to be talking about concussion therapy. With me, I have Holly VanCleave. Holly is a physical therapist and a athletic trainer with Salina Regional Outpatient Physical Therapy. Thanks for being on the show.
Thanks.
I know when you and I first talked, we're kind of looking at a topic, and you said physical therapy for concussion, and I said, what? It doesn't seem to really work, but it really works.
Yes,
right?
yes. What we found is the old version of treating concussions was cocoon therapy. Put them in a quiet, dark room, sit there for 2 weeks, and then bring them out and see how they do. And research has shown that it actually expedites the healing process to get them involved in some low-level activity while they're recovering from a concussion. It helps stimulate the brain and challenge them while they're healing instead of just staying stagnant for 2 weeks and then trying to get them back into activity.
So what kind of activities are you doing with them?
So we'll initially see where the biggest deficits are. Is it in their vision, or their balance, or their coordination, memory, or just physical exertion? And so after all of the testing on the first day, we can determine what part of their brain is affected the most and focus our treatment on that. So we might have them focusing a lot on vision. If their visual tracking is off, then we've got a lot of different exercises we can do with that. We've got a big checkerboard that has letters and numbers on it to help them look at a busy background and find different objects. Sometimes it's more of a balance problem. So we have rocker boards, foam. We have a balance platform that measures their degree per second sway, so we can see how much they're improving or how much they're affected. And then other people are more musculoskeletal, so their neck might be affected, either the range of motion or muscle guarding or their ability to determine where their head is in space.
So you're finding it's really speeding up the recovery time?
Right, because another thing we know is some hypomobility in the neck joints causes dizziness and headaches. So maybe they're having some concussion symptoms, but if we can resolve the musculoskeletal issue, it takes away some of those big symptoms and makes them feel better earlier than just sitting there and then still having a stiff neck and not being very challenged while they're at home from school or out of activity.
How can somebody get a hold of you guys?
So you do need a referral from your physician. Okay. So talk to your doctor first. They would send over a referral to our office. You can also call our office at 452-6668 to schedule an appointment if you have a referral from a doctor out of network.
Okay. Thank you so much.
All right.
Thank you for being on the show. Thank you for watching. For more information, please visit srhc.com. Like us on Facebook and follow us on Twitter.